Okay. Hopefully we don't lose too many people in the process. All right. They updated my Zoom and I think maybe, I don't know. Okay, so Kimberly, who would you like to take over doing the slides?
Oh, me. Yeah, I will do that.
Trin? Okay.
Okay, yeah.
Okay, let me give you the ability to do that. Where'd you go? Okay. Okay, Trin, you should be able to. All right, we got it.
Yeah,
Yay. Technology. It's so wonderful.
okay. So, yeah, so my member will talk about describing about the Facebook.
Good job.
I'm Jafet. I'll be talking about describing Facebook. Facebook is a social media platform that allows users to connect, interact, and share content with others online. It includes many features and uses for the platform users, such as content sharing, promoting posts, Facebook Live, Marketplace, and Facebook Analytics.
I'm Yadira, and I'm presenting how to set it up. You would first create a standard free Facebook account. You would then navigate to Facebook pages and create healthcare page. It would include important information, organization's name, relevant categories, description of the organization, location, and contact information. You would add and complete your profile. This includes identifiable logo and high quality photos which reflect the organization's mission statements and values, details about various services, and include links to direct users to contact or book an appointment, etc. You will also need to develop a content strategy. This includes regular posts about health education, such as preventive care and wellness tips, news and updates, new services, patient and clinician stories, such as testimonials about high quality care. You would also identify demographics and needs to develop content around specific health concern and interests in the community. You would then promote and engage with community. You can monitor engagement with polls and surveys, responding to comments, and encourage users to share experience and questions. You will promote page with partnerships and links to Facebook through healthcare organizations' website and other social media. You would post about local health events and partnerships and tailor content based on seasons such as flu season awareness and tips.
And sorry for the inconvenience. So I will be talking about the step-by-step on how to take advantage of our Facebook platform. It is important to know how to use and navigate our Facebook platform to ensure patient satisfaction and quality care. By engaging with the organization through Facebook, it allows patients to know more about what our clinic has to offer. Key step number 1, when navigating our healthcare account, is to make sure our patients follow us to view any notifications regarding special events, raising awareness about any important health issues, promoting health, updating our patients about our new facilities the organization might open up. Also, another key step is after building community trust and retention, our Facebook platform will allow patients to join private groups where physicians or other providers can help the community with any health issues through telemedicine. And from there, depending on their situation, providers can schedule in-person appointments with patients to give the quality care they deserve. This would help promote efficiency instead of just waiting on the phone for an appointment. Lastly, another way our Facebook platform can help an organization's reputation and gain new patients is by incorporating patient reviews about their experience when receiving any healthcare service. By adding reviews, it will allow patients to have a clear view of how we treat the community, helping it build comfort between a provider and a patient.
So moving on to real world examples of Facebook in healthcare, it could be used for educating the public and community engagement in health related services. So hospitals and healthcare providers can educate the public by creating posts to share health information, wellness topics, and research activities. On the left are screenshots from Dignity Health's Facebook page, where they provided helpful first aid information and a link to sign up for a CPR class. Another way to educate the public on health topics and disease prevention is by broadcasting a live conversation on Facebook. On the other side, the screenshot on the bottom is actually a flyer posted on Facebook to inform the public that there'll be a live event held by a doctor to provide information about rheumatology.
Hi, so my name is Ayman. I'm gonna do the second example, and I chose community engagement in health-related services. Through this, you're able to disperse quick links. As you can see in the picture to the right, Long Beach Department of Health and Human Services links a flu shot location to get your flu vaccine. So yeah, it's easy to give you services and health resources, hospital locations, acute care facilities, even community fairs, health hotlines. And it's a way to promote health awareness campaigns and support health initiatives, or on the right, vaccine drives and mental health resources. So with private and public groups and online communities or forums, it allows patients and caregivers to connect with other people who are facing similar health challenges. These platforms provide emotional support, enabling people to share their experiences and information about the treatments that they're going through, coping strategies, and allows them to foster a sense of belonging, which is very important. Another way to be involved in community engagement is creating fundraising campaigns. This is huge. A lot of people can just link whatever campaign that they have, and people have the ability to click on it, share it, maybe join a Zoom call to learn some information about it. On the left, there's a resource state career fair, and it just gives information about what day it is, the time. So it's, yeah.
So for our group it should be done. So thank you for watching us.
Thank you.
Okay, good job. Well, the three groups did a good job, very thorough. Got some good information out of that. I'm sure when people go to respond and comment that there's something new that I'm sure everybody learned from each one of these. I know every time that this is done, I learn something new. So great job. Okay. I was going to start going over the proposal for the business plan so that we can, and I think I'll go ahead and do that. I'm going to share my screen so that you have a little bit of idea of what I'm looking for with the business plan, and we'll start it now, and I'll go do about 10 minutes or so, 10, 15 minutes, and then we'll finish it up Thursday going over it after the last two groups do their presentation. So let me share my screen. Give me just a second, because I don't know why Zoom and Canvas both have been irritating me greatly this week. Give me 1 second. Although Canvas irritates me all the time, but it seems to have been in good form this week. Give me 1 second. All right. When I rebooted, it disappeared. Let's see. Don't want that. Oh, brother. Let's see. Seems to have disappeared. Let me get it off of Canvas. Give me 1 second. Because I want to do the actual proposal, not the PowerPoint. Give me just a second. Alrighty. There's also, besides what I'm going over, there is a PowerPoint that goes into more detail also under modules. Okay, so this is what you're going to be. Can everybody see that? Are we good? Thumbs up? Yes?
Yes, I can see it.
Okay, thank you, Danny. All right. So this is what you're going to be completing for your business proposal. Now, it looks relatively simple, but it does have a lot of detail. This is the format you're going to use, and there's also, I believe I put an example on under modules of one that was completed by another class sometime back, but this is what this is basically what you'll be turning in, but it'll be full of all kinds of valuable information when you finish it. So on this executive summary, what an executive summary is it's usually 2 to 3 pages that tells the reader what is in the proposal that follows. Basically, it summarizes everything very succinctly into these 3-page document. So let's say that you were going to go to a bank and ask for money to do your proposal, to do whatever business it is. What they would first look at is this executive summary to see if it's even something they're interested in. Then if it is, then they would go into more detail in the main proposal. So you cannot complete this executive summary until you've completed the main proposal, which will follow. And once you do that, then what you're doing is summarizing each section of that proposal and putting it into this executive summary. On this number 1, what do I include? That's just for your information on what all should be in this information, this executive summary. And in this case, because we're doing it as a pseudo sort of business plan, what you could put in here is you could just type in information from proposal. You don't have to really put anything into this number 1 section. Then the number 2 section is marketing highlights. So you're going to highlight the way you're going to market your new company. Now remember that this new company is a totally created company by your group. You're going to name it. You're going to find a place to locate it. Everything you need to know to start a business, you're going to have done in this project. So marketing highlights are things that might include how you're going to go about marketing it. Are you going to use social media? Who are you going to, how are you going to get to your target group? Those kinds of things. So marketing highlights includes everything you're going to do to market your new company. Now remember, you're going to have to also have your chief competitor. You're going to have information on that, and that's a real company. So let's say you decide you want to be a plastic surgeon. A lot of people do the plastic surgery business because there's so many ways to go with plastic surgery. You know, you can do the Botox, you can do everything from Botox to reconstructive surgery to, you know, lifting somebody's behind to, you know, whatever it happens to be. So there's lots of things that go into plastic surgery. So let's say you're going to do plastic surgery. What you're going to be doing then when you create your business is what your group thinks would be marketable, what your group thinks would be, you know, would be able to garnish enough of the business to take it away from the established businesses. Then when you look at your competitor, your biggest competitor, you're going to look at some other business, some other plastic surgery business that is in the area, probably, unless you plan on building your, you know, your clinic in Alaska, which is okay if that's what you want to do. It does not have to be in California, but it might be a little more difficult to get all the information that you need. But you need to find a competitor that is close to the area where you want to do it, and then you're going to compare what they do and what you plan on doing with your company. So the marketing highlights are just what are the main things you're going to do to market your company. Your target market summary is who are you going to market it to? Who are you aiming at? If you're doing a pediatric clinic, you probably are not going to market people in nursing homes, right? Because that would be a waste of your money. So who is your target market, and how are you going to locate them? How are you going to be sure that your dollars are spent well and that they have the information about your company? Okay, your competitive analysis. This is what I was talking about a minute ago. You're going to find a company that is basically serving the same population as you are with your company, and then you're going to compare what they offer, what their target market group is, and so forth. And we'll go into more detail on that when we get in the actual proposal. But again, this is just the executive summary is just summarizing what's in the actual proposal. Then your key marketing strategies, you know, what are the main things you're going to do to be sure that your information gets out there. Your operational highlights, we're going to go into more detail when we get to the proposal, but that's what are the main things about your company, that keeps it operating. This is where you can look at, you know, maybe the hours that you're going to keep, how you're going to carry on business. Are you going to be a face-to-face? Are you going to be internet-driven? How are you going to go forth with your company? What are some intermediary concerns? That means what are some concerns at the moment that you might have with getting this company off the ground? And this might be things like too much competition. It might be a lot of money, takes a lot of money to startup money because of equipment or because of licensing or whatever it happens to be. What are some of the concerns that are specific to your company that would maybe causing you problems? Your management team overview. Now, you don't have to tell me a person's name, but you're going to say, okay, we're going to have a CEO who's also going to function as a CFO. Because a lot of companies have dual roles when you're first starting out because the money it's too difficult to pay $200,000 salaries or whatever it happens to be. So what kind of management team are you going to need for your company? Then you've got financial highlights. This one becomes a little bit stickier because this is going to be, you're going to project your money that you're going to need for startup and project the money you're going to need for operating. The way you're going to do that is you can't just come out with some far out figures that don't make any sense. You're going to search the web and you're going to find companies similar to yours, and it doesn't matter if they're in the area or where they're at, but all companies that are publicly held have information like this out on the web about them. They talk about their finances. Let's say their money spent on rent, money spent on insurance, all those things are readily available out on the web. You just have to hunt for them. And you can also, the library also has business business documents and things that you can get at, that examples that you can use to see what is reasonable. And then, what is reasonable for operating expenses? Like, you may have a big place in your heart for nurses, so in your company, you're going to pay them $300,000 a year. Well, I would say that's not reasonable. So you need to, and the way you find out what is reasonable for salaries is you look at Glassdoor, you look at the Bureau of Labor from the U.S., your U.S. Bureau of Labor. All those places have medium or average salaries for the area, and that's where you can figure out how much you can reasonably pay somebody. So you got to do a lot of research on all these different pieces. And then what are unique concerns to your company specifically? Again, that could be like expensive equipment, it could be security, it could be, all kinds of things that would be really specific to the business that you are trying to open. Now, I know this seems a little overwhelming, but I can tell y'all that every semester students feel a little overwhelmed, but once they get into it, they really like this project, because a lot of students at the beginning of the semester will tell me, I want to start my own business. I don't want to work for anybody, but have no clue what it takes to start your own business. So this takes you down to the nuts and bolts of starting a business on your own. Now, the company profile, what type of organization is it? Are you going to be a clinic? Are you going to be, I've had students do gyms, health spas, plastic surgery clinics, orthopedic clinics, anything that has to do. I even had one group one time, it's actually pretty good, that did it on oxygen, opening up a business that, and I don't even know if they're still around. I think COVID might have dealt them a blow, but where you go into these places in the mall and different places, and you can suck in oxygen that's got different flavors, or whatever it happens to be. I even had one group do that. I am open to almost anything that is health related. So that's what type of organization is it? What is your name? You have to give it a name, and don't just call it I don't know, Danny's Wellness Spa. Give it a name that makes sense, that people would know what it is, and typically try to get the name to be draws attention. Okay, your hours of operation. Think outside the box with the hours of operation. Can't remember if I told this class or not, but my daughter, she has the two grown kids. One's at the Air Force Academy, one's at the Naval. Well, one just graduated from Naval Academy, but she has a second set, and they're like 10 and 8 now. And she works full time, and so sometimes it's difficult to get to the pediatrician. But there was a doctor in Tampa whose hours of operation at that time were Thursday night through Sunday, I think is what it was. And they stayed open until like 9 o'clock on Thursday night. And on Fridays, they were open from like noon to 9. Then on Saturdays, they were open all day like a regular business day, and same for Sunday. So what they did was they had a land office business, because parents, oftentimes in today's world, they both work. So there is no way to take off and take the kids to the doctor. So this pediatrician addressed those needs, and they had a number of pediatricians working there. So you had different ones that weren't the same ones always working, on Saturday and Sunday. And then I think they were off completely on maybe Monday, and then they had regular hours on Tuesday and Wednesday. I can't remember exactly what it was, but whatever it was, they made themselves available, at unusual hours. I think one day they opened up like at 6:30 and closed at 2:30. But anyway, so when you're thinking about your hours, think about what might make you more appealing to your particular target group. Okay, I'm going to close this down now because it's almost time to go. Do I have any questions so far? Okay. All right, so here's what we're going to do. There is a PowerPoint up there that describes this also. So if you have time, I would look over that. So if you have any questions on Thursday, you'll have them ready in case I don't cover everything that you have a question about. So Thursday, we're going to do the final two groups, and then we're going to finish going over the proposal. And if we have time, I'll give y'all a bit of time to work together as a group to start getting organized with this. Okay, are we good? All right. All right. I hope y'all have a great couple days, and I will see y'all this week. We do have class on Thursday morning, and I will see you on Thursday.
Thank you.
You're welcome.
Thank you.
You're welcome.
Thank you. Have a good
Professor,
one.
I have a question.
Uh-huh.
I know you had messaged me through Canvas about the business plan contract. I don't know, for some reason I got confused with the presentation. So like my head went, okay, like someone's gonna turn it in. Like that's what I thought it was. But I just realized like later on when you sent me the message that it was like everyone had to turn it in.
Uh-huh.
But I don't know if you could still receive it, although the assignment is locked.
I'll
I just
unlock it. Which one was
I
that for?
It was for the business plan contract, but I just sent it through feedback where you sent me the message.
Oh, you
But I
did
could
send it.
still,
That's fine.
yeah,
If you put it, you know what? Let me unlock it for you, Kimberly, because when it's like that, I don't see it. So it's hard for me to change the
okay.
grade. So I'm going to go in right now and unlock it, and you can go ahead and submit it, okay?
Okay, thank you so much.
You're welcome, Kimberly.
Have a good day.
You too. Anybody else? Questions? No?
Yes.
Uh-huh.
I just want to ask. Usually all the class we have the record, like a record, right? The recording for the
Yes,
Zoom
this is
meeting.
okay.
Yes.
I don't know if it recorded this little piece or not. It recorded the first part, and I'll
Yes.
be uploading that.
Oh, okay. Because I just want to, like review like how is the presentation going and what is my mistake. I know that I a little bit, get interrupt over there.
Yeah.
Yeah.
You
So
know,
I want to improve.
yeah. This is recording too, so I'll upload both pieces.
Yes. Okay. Thank you so much.
You're welcome.
Yes. See you on Thursday.
Sounds good. All right.
Have a good day. Thank you.
Uh-huh.